10 Myths and Misconceptions of Bowel Habit, Part 1. 1. Do we need to have bowel open every day? Normal bowel movement frequency varies from person to person. And the important thing is whether you feel comfortable. Generally, bowel movement frequency can range from 3 times a day to 3 times a week. A healthy bowel movement will pass smoothly and without pain and straining. The stool is not too hard and lumpy or too loose. Therefore, don't worry too much about having to defecate once a day. 2. Is constipation just a small problem? The normal digestive system of the human body digests and absorbs the food that is eaten, and finally excretes the food residue out of the body, which becomes feces. Abnormal bowel movements, including constipation or diarrhea, can indicate bowel or digestive system problems. It may also be a sign of bowel cancer. So do not underestimate the problem of constipation. 3. Is constipation normal as we age? Constipation is a common problem among older adults. The prevalence of constipation increases with age. Peristalsis of the intestine among older adults is usually weakened, hence they are more prone to constipation. Poor diet due to loose teeth. Inadequate fluid intake due to fear of frequent urination. Limited mobility and insufficient exercise, as well as multiple comorbidities and medications, are also common causes of constipation among older adults. As long as you maintain a healthy lifestyle, constipation is preventable. 4. Why do I still have constipation, despite eating a lot of green vegetables? Many people think that eating more high-fiber vegetables and fruits can promote intestinal peristalsis and help bowel movement. However, if you eat too many fruits and vegetables without drinking adequate water, it will make the constipation worse. Dietary fiber increases fecal volume and stimulates peristalsis. It swells, absorbs water and lubricates the intestine to soften feces and make defecation easier. If fluid intake is insufficient, fiber cannot absorb water and expand, causing the stool harder, and constipation resulted. While eating more fruits and vegetables, you must drink enough water to make your bowel movement smooth. 5. Should older adults drink less water to avoid frequent toileting? Maintaining an adequate level of hydration is important for proper function of the whole human body. Inadequate fluid intake is very common among older adults. With aging, thirst sensation is disturbed, and they deliberately limit fluids to avoid frequent toileting. Too little fluid intake can lead to dehydration, constipation, and poor digestion. If severely dehydrated, it may cause hypernatremia, affect heart rate, and even coma. Adults generally drink 8 glasses of water a day, which is 2 liters. However, older adults usually have reduced renal function and poor circulation. Too much water intake will cause edema. In such case, older adults should drink 6 glasses of water each day, about 1,500 to 1,600 milliliters.